So transplantation really falls within two remits. There's two things: FUT, which is follicular unit transplantation, and there's FUE, which is follicular unit extraction. The FUT transplantation is, I suppose, what you would call the more traditional form of surgery and the more surgical procedure, where we take out a strip from the back of the head, and that strip is then divvied up progressively into smaller units, eventually becoming out as single follicles that we then transplant back in. The FUE procedure takes it as very tiny little, almost like biopsies, little punch biopsies from the same area, same bank of hair at the back of the head, and then they're taken as they're units already, so there's no slivering required or cutting up. They are as they go in. So they're taken out and put back in. The main difference aesthetically at the end is not to do with the hair, the transplanted hair, it's to do with the donor area. So the strip surgery always leaves a scar at the back of the head. The minute surgically the dermis or the second layer of skin is tampered with, that leaves a surgical scar. So what we're really doing with the FUE or the extraction technique is we're distributing the scar tissue. Actually, the scar tissue with FUE, if you were to stack up all those tiny little dots of scar tissue, is a bigger bank of scar area than you would have if you did the single strip technique. So it's really a misnomer as to it being scarless surgery. It certainly isn't. It's just that you've spread it out over a bigger area.